Okay, good afternoon, everybody. It's 1 o'clock now, your time. We're on a little bit of a tight time schedule today, so we're going to go ahead and get rolling on this. Um, I had a little discrepancy on my calendar. I had this marked as an overview session, but I believe we did the overview last week, and we're getting into operational planning today. Can anybody verify that everybody on here has been through the overview? Okay, great. Okay, so what we're going to do today is we're going to talk about operational planning. We're going to go through the pyramid model once again, just kind of as a refresher here. We're going to talk about different formats that we see in operational planning models, basically the same model, different nomenclature. We're going to review each different level of the pyramid. So we're going to talk about the groups. We're going to talk about the service initiatives, goals, objectives, and activities. And what we're going to show you are real live examples from public health departments in different areas that they use different terminology in here, and then what some of the actual names are. You know, what are some of the goals? What are some of the objectives? Some of the activities? And then kind of to end it up, what we're going to do is actually use a template that I've just attached to the meeting request. You may have seen it, and we're going to talk about that template as a vehicle to enter an operational plan into the system, and we're actually going to go in and enter this operational plan. We're using the same example we used before with tobacco cessation in high schools, that sort of thing, just to kind of keep continuity in there. And then what we're going to do at the end is we're going to ask everybody here to go away and create a simple little operational plan. And we'll give you a couple options. You can either use the template, which again I've attached to the meeting request. You can either use the template and put it in there if you're not comfortable yet going into the system and doing it, or you can go directly in the system under the training group that we've created, so you can enter it directly in there. And then the next training we do will be a review of those plans. And it's very simple. You know, we're going to ask you to do under the group, you're going to have basically one service, one goal, one objective, and maybe three activities representing the three different types of activities here. So that's kind of the plan for today. Typically, this session takes about 45 minutes. So I'm going to go ahead and get started. We're going to get past the horse here. So again, to review the pyramid model, the top is the organization, your health department. Underneath that are the groups. So the groups are divisions, offices, programs, and primary plans. So let's go look at the group structure in your department. So here we are. At the very top, level one group is the department. And you can see underneath there, we've got the strategic plan, the CHA chip down here. We have a group called administrative services. Then we have a group called clinics. Under clinics, we have clinic admin, we have clinic services, HR, environmental health. And by the way, these can be all moved around and reporting to different levels, but this is just the current structure. Down here, we have the pathways recognition program for FAB. I'm assuming you guys are going that direction here. We also have all the other plans. If you want them, we can put them in there for you. Down at the bottom, we created this new group that everybody has full access to called training. And then underneath the training group, I put a little group called Tobacco 2023 that we'll be using today. So this is the basic group structure. When we get into performance monitoring, you'll see that this is kind of important when we're using the dashboard. So let's go back here to our pyramid. Now, underneath the groups, then, each group has a set of services or initiatives. And again, services are ongoing things. Initiatives are new things that we're doing. Primary difference is services typically have current dates in the activities, whereas initiatives typically have future dates in the activities. Each service then has a set of goals, each goal a set of objectives, each objective a set of activities. So we're going to walk through live examples of what each of these levels look like. But before I do that, there is no per se industry standard for this nomenclature, the groups, services, initiatives, goals, objectives, and activities. And you'll see varying nomenclature if you look at different plans. So somebody may hand you, here's our chip, it's all done, go put it in the system. And you'll look at the terms and it's not services, initiatives, it's not goals, objectives, activities, it's something else. The pyramid stays the same, though. The model is the same, it's just the nomenclature. So what I'm going to do is kind of review six of the different things that we've seen in different plans across the nation here. So the first one Where we have services or initiatives, they're called strategic priorities. And these are typically in the strategic plan itself. And then underneath that, goals, strategies for objectives. I personally don't care for that because I think strategies are how we get to the objectives. And then you have objectives for activities. So I think those two are kind of reversed. Strategic areas, that's pretty good. Goals, outcome objectives. I like that terminology because the objective is, what are we trying to accomplish? What is the outcome we're looking for? And then strategies is pretty good for the activity level. So what are the strategies we're going to implement to get to the objective? Priorities, goals, objectives, and action steps. I can tell you action steps is the most common alternative we see for activities and very descriptive. The activities are the steps you're going to go through to get to the objective. Priority areas, goals, strategies, action steps. Again, strategies for objectives, I don't really care for that. Priorities, goals, objectives, and strategies, that one's pretty good. And then strategies, strategic objectives for goals, I kind of like that. And then objectives, and then action steps for activities. So the idea here is if somebody comes to you and says, here's a plan, put it in the system, you're going to kind of look at this and say, I still understand the pyramid. I understand the model here. It's just different names in there. Now, let's go look at some groups. Again, the groups are divisions, offices, programs, and again, primary plans. So typically the primary plans are what FAB calls their 6-pack of plans, and we'll talk about those here. So typically the department is the highest level group. So health department administration, we call it. The levels indicate the hierarchy of the group. So level 1 is the top level group. They go up to level 10. I think I mentioned before, nobody's ever gone past a 5 or a 6 to the best of my knowledge. Underneath that, you might have something like community health division at a level 2 reporting to the department. Under community health might be WIC, for instance, reporting to community health, which reports to the department. Your strategic plan can report directly to the department, being a level 2, and then the rest of your CHIP and your CHA and your workforce development and such could also be in there as well. For today, we're going to use the same example we used before. Tobacco 2023 is the group. Under the groups, then, you're going to have a set of services or initiatives. So these are some real examples. Healthy moms and babies. Now these, I call the buckets. They're not necessarily descriptive of something we're doing other than it's a place to house the plans that are related to, in this case, healthy moms and babies. Readiness for emerging health threats, effective agency processes, access to care, behavioral health and substance abuse, population health, organizational excellence, chronic disease prevention and control, health disparities, and then tobacco cessation would be our initiative under here. So I think you can see how these are just groupings of specific plans that would be following underneath here. The next level would be goals, and goals are a simple description of what you're trying to accomplish. So it's an action in here. So for instance, reduce the risk of infectious disease, promote safe and sanitary food establishments, support communities in building resiliency, enhance healthcare through technology, drive health in all policy agendas, reduce the risk of vaccine preventable diseases, promote public health readiness and response, promote succession planning and career growth, integrate a data-driven best practices approach, and then again for today, reduce smoking in high schools. So the thing to look at in goals is, are they fairly general? Typically, it's an action verb followed by a few words, as you can see, and they're not really specific. So reduce smoking in high schools. How much are you going to reduce it? Which high schools are you going to do it? When are you going to do it? Those aren't part of the goal. Those will be part of the objective when we get down to the next level. And that is the next level, SMART objectives. Again, SMART being specific, measurable, attainable, realistic, and time-based. I think somebody was trying to make the word SMART, so attainable and realistic to me are kind of the same thing. You know, is it realistic to get to that objective? So yeah, I think so. But specific, measurable, and time-based are kind of critical in there. So we're going to go over some live examples again. By December 2023, we're going to identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. by December 2023, 80% of educators and school staff have been exposed to ACE awareness education. By June 2023, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported within a VMSG dashboard. And then again, our example for today, reduce smoking at Wayne High School by 25% by the end of the school year. So again, the objectives have a lot of specificity, if that's a word, when we're going to get to them, exactly how much we're going to do, and specifically what we're going to do. Now, under the objectives are the action steps or the activities, in fact, the steps that we're going to go through to get there. Now, within the activities, there's actually 3 distinct types of activities. We're going to talk about each of those here. So the most common one by far is the project-based activity. By the way, this was the only type originally in the system, and then it was the other types were added on over time at the request of customers. Project-based activity is exactly that. Think of something that is a project that has got a beginning and end. So we're going to create training content and materials for students and faculty on the dangers of smoking. So in this particular case, we're going to be doing maybe some PowerPoint slides, maybe some videos, training manuals, things along like that, the materials and stuff we need to do the training. Every activity will have a performance measure. In the project-based activity, you are responsible for coming up with a performance measure. And it's all it is how do I know when I've successfully completed the activity? So in this case, we are going to create training content. Once we've created the training content, we're done with the activity. We've got a date range in there, and over time, these dates can vary. It depends on, the real world going on here. If COVID happens and you don't have resources to do this program until after COVID, then you put it on hold, move the dates around. Team assignments, we're going to assign team members and team leads and external partners. The metric in this case is percent complete. So how far along are we? We'll talk about different options in percent complete when we go through it. So that was the project-based activity. The least common activity, if you will, is the quality assurance activity. It's unique in a couple of things. First of all, it's repetitive. So you'll see that, it's repetitive, and secondly, it automatically sets the traffic lights. The traffic lights in the other activities are manually set based on your information, unless it goes to 100%. If it goes to 100%, it automatically sets it to gold. If you're looking at that saying, we're at 100%, but this is going to vary over time, we don't want to call it gold, you can then set it back to green typically. In this case, we're going to say we're going to provide 9 training sessions each month on dangers of smoking. So we're going to take the training content we just created, and we're going to go to the schools and provide those 9 training sessions each month. If we do 9, it's going to set the traffic light to green. If we do 6 or less, it's going to set it to red, and then you can calculate in between 7 or 8 will be yellow. In this case, we have, instead of a beginning and ending date, we have a cycle start date and a frequency. So May 1st, 23 is the beginning of our cycle. We're going to go for a month. Then we're going to move the date forward to June 1st, and we're going to calculate for a month. And then July 1st and calculate for a month. Our performance measure is created for us at this particular activity. And we'll see that through the wizard. Training sessions provided, measured monthly, our green, yellow, and red. Then again, we'll do team assignments, partner assignments, and our input metric for this particular activity is the number of training sessions provided. So that's the QA activity. Again, the third most common type of activity. The second most common, I guess maybe this is kind of in backwards order here. The second most common is what we call a quantitative measurement activity. In the project-based activity, you are kind of responsible for calculating the percentage done. So in the example we were using before, we talked about having 4 chapters that we were going to create for the training content. And when I completed chapter 1, I marked it as 25%, chapter 2, 50, chapter 3, 75, and chapter 4, 100%. So you're responsible for doing that calculation. In a quantitative measurement activity, it's very much similar to the project-based activity, except that you're counting something. And it can be widgets, it can be tobacco vendors in this case, it can be dollars. And then based on a target number, in this case 20, you're going to be able to calculate that percent for you. So it's just a different way of getting there. So in this case, we have contact all 20 tobacco vendors within 1 mile of Wayne High School to assure they're not selling to minors. Our target quantity, as you know, is 20. So this is the denominator to calculate our percent complete here. Again, we have the date range, just like we do in the project-based activity. Our performance measure is created for us, again, 20 tobacco vendors contacted between May 1 and June 30th. And then we always do the team assignments and partner assignments if it's applicable. And then our metric in this case is we're just going to measure the number of vendors contacted. So that's the 3 types of activities. So if we take all of those together and build them into our little plan that we've been working with, it'll look like this. The group was tobacco programs for 2023. Underneath that, we were looking at the service or initiative of tobacco cessation. And what we're saying for the purpose of today is tobacco cessation is a program we're just starting or a future program, so we're going to call it an initiative. The goal under that initiative is to reduce smoking in high schools. We have an objective to reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through that we believe will get us there. Create the training content, provide the 9 training sessions each month, and contact all 20 tobacco vendors. So that would be the first piece of the plan. Now we might also then have another goal of reduce smoking in colleges. And then underneath that, we might have an objective to reduce smoking at Wright State University by 25% by the end of the school year. Then under that objective, you'd have similar activities, maybe not contacting tobacco vendors because you wouldn't typically have any minors in college. So something along that line. But this is an example of the plan itself. This is the one we're going to use for today. Now, this is a template. This is a version of the template that I just sent you, kind of filled in with the tobacco cessation example. But this template was actually developed by one of our clients in Wisconsin as a way for people who aren't yet comfortable entering data into the system of creating a plan, looking at it, maybe talking with their staff and their teams about it, and just saying, yeah, this is good. Let's go ahead and put it in the system. So we're going to use this example, and basically what we're going to do is copy and paste it into the system. And the reason we're going to do that is just so you can see all the button clicks and everything that we have to do to go through those steps we were talking about in there. So our first, I'm going to now take you live into this particular plan. So here's the Word document that we're going to be using. So you notice service initiative. It says, what bucket of work or priority does this relate to? We're saying tobacco cessation. So what I'm going to do is copy that. I personally like to use keyboard shortcuts. It's quicker and easier for me, but you can right click and say copy if you want to. In this case, I'm going to use Control C on my keyboard to copy. Now I'm going to tab over to the system itself. Now down underneath this group, I'm going to go down the tabs to my next tab, which would be services or initiatives. And you'll notice down here, I can't add anything because it's blocked off. So either I click down here or I click the plus button. It's identical. So I'll click here for now. And then I'm going to use Control V as in Victor on my keyboard to paste that into there. Now we talked about this being a future service, if you will, or an initiative. So I'm just going to hit the checkbox here, call it an initiative. Every time I change something down at the bottom of the screen, I have to hit the save button. What it's doing is taking local data on your computer and then shoving it up into the server up here. So everything up here is basically reading the server down here as local data. And that obviously makes it very efficient to doing a multi-user system. So tobacco cessation is our initiative. Underneath that, then we have the first goal, reduce smoking in high schools. So I'm going to grab that. Again, Control C to copy it. Then back over to here. Now I've got 2 choices. Either I can click on this little right arrow, which is my drill down to my next level, which would be goals. Or in this case, it makes just as much sense just to click on goals. Where the right arrow makes sense is if I had 10 different initiatives down here, instead of me clicking on the 10th initiative and then clicking on the tab, I can click on the right arrow and it does both. It just saves me a click is all it does. I'm going to go to my goals tab here. Now again, we're blocked off down at the notes, or down at the bottom here. So I'm going to click on that. I'm going to hit Control V to paste that in there, reduce smoking in high schools. Go ahead and save that. So now we have the first goal. I believe there are other goals here. So let's scroll on down. There we go. So we have another goal under the same initiative of reduce smoking in colleges. Again, Control C, come back here. This time I'm going to hit the plus button, paste it in there, Control V, save it. Let's go back to our plan. And I think we have another one, reduce smoking in public areas. Again, Control C, go back over here, hit the plus button, Control V, and we'll save that. So now we have 3 different goals, and we would build the plans under those goals, just like we talked about earlier. So I'm going to go back to reduce smoking in high schools. A couple of new things. This button down here, this field down here is called data source. And what that is a source of data that you would potentially use to update this particular goal. It's available at the goal, the objective, and the activity level. So you can have lots of different data sources. In order to put a data source in here, you just click on here, opens up the little window. I'm just going to call it CDC smoking website. And I don't have the whole link, so I'm just going to put in a link to the CDC website. In order to put this link in here, you have to put the entire link in, meaning you start with HTTP or HTTPS : / and then your web link in there. So I'm going to put in HTTP : / www.cdc.gov and hit OK. Now you may notice when I did that, it puts the description down here, and then over here it has a little link, in fact, a chain link, if you will. I'm going to go ahead and save this again. Again, anytime you do something down here, you're going to save it. Hit the little chain link, and what it's going to do is open up in a new browser tab, and it's going to take me right to the CDC website. So the idea of this is if you have a website that is going to be one of the data sources for keeping the plan up to date, you can link it right to that particular plan element. Something we just added a couple of days ago that you might notice, you can type a note down in here anytime. And notes are just kind of generic. You can put anything in there. Typically, if I change the traffic light down here, I'm going to put a note down here as to why I did it. But we'll just say, so I'm a test note. I'm going to go ahead and save that. Now, the issue with this is at this point in time, unless you go look at the history record, you don't really know who put this note in, when they put it in. So we added this new feature, this little button right here, this little calendar, if you can't see that. If I click on that, what it does now is put in my date, time, and this just happens to be system admin is me, the user here. And then I can put in a note. There's another test note. So basically what it does is give you a time and date and person stamp so that you can record that. Now, you don't necessarily have to use that. Even if you accidentally do it, I can go in and erase that before I type in my note if I want to, but it's just a new feature that was added in here. So that is our goal of reduce smoking in high schools. Again, we have a data source down there. We've got the notes button down here. At this point in time, you can start setting the traffic light as well. A couple ways to do it. Number one is you can just cycle through the lights with your mouse. Or you can use the drop down. Some people like it different ways, so we put both of them in there for you. So I can go in there and just say I'm going to select the green light. And again, anytime I change it, I'm going to hit the save button. If you don't hit the save button and you try to leave the screen, it's going to give you a little dialogue that says, hey, you forgot to save it. Do you want to save it? Go ahead and save that. I'll talk about that no dupe here in a minute. Okay, so now I'm at the goal level. Now I'm going to go down to my objective level. And again, we can't do anything until we open it up here. So I'm going to click on that. Now I'm going to go down to my document again. I'll scroll back up to the top. Okay, let's look at here. So my first objective is to reduce smoking at Wayne High School by 25% by the end of the school year. So again, Control C, go back over to my objective, Control V, paste it in there. I'm going to go ahead and save that. Now I'm going to go ahead at this point in time. Again, I can change the traffic light if necessary. Typically in a new program, you're not going to change the traffic light. Default is green because it's new. It really can't be behind schedule at that point in time. And then I'm going to click on the drop down for objective lead. The reason that nobody is showing in here is because nobody is assigned to the Tobacco 2023 group. So if I hit show all users, it's going to show me everybody in the organization. We'll just go ahead and assign Brian here just for kicks to start with. So Brian is now the objective lead. Again, I'll save that. And so what that means is Brian is responsible for updating the information on this, and Brian is going to get an email notification on a regular basis to come back and do exactly that. Now, down here, the default is objective % done and measuring in percent. You can change this by clicking on the title down here. I'm going to go up here and call this percent reduction. So what we're trying to do is reduce the smoking percentage in the school. I can either look at decimal values down here. So if I'm counting something, whatever it happens to be, or I can look at percentage values. In this case, we're looking at percent. My measurement units is percent. You can put whatever you want in there. There is a character string limitation on here, and it'll tell you if you get too far. I think it's like 17 characters on the top and maybe something similar on the bottom here, but it'll let you know, and then you might want to think about how would I abbreviate that. The reason is you got a limited amount of space down here. So I'm going to say percent. So now you'll notice down here, oops, we have our percent reduction is whatever it happens to be at the point in time. This is where you can enter it, not using the quick update. You can enter that value right into here again and save it. No do. Okay, so now we have our first objective, reduce smoking at Wayne High School. Let's go back and see if we have, okay, we do. We have another objective here, reduce smoking at Desert Vista High School. Again, Control C, go back over here. I'm going to add a new objective, so I'm going to hit the plus button here. Control V, reduce smoking at Desert Vista High School. We'll save that. We'll leave the traffic light as is for now. We'll go ahead and just select somebody else to be the lead here. We'll select Julie and save that again. And then you'll see over here, it identifies the objective leader in here. So that's our objective at this point in time, to reduce smoking at Wayne High School. Now, under the objective, we're going to have a set of activities that we believe will get us to the objective. I'm going to go down to my activities tab here. And again, we're blocked out, so I click on that. Now back over to here. So our first objective, we have 3 different activities. You'll notice I marked them as project-based, quality assurance, and quantitative measurement. So we'll go through each of these. Our first one is the project-based activity. Oops. Control C, go back over here, add it into here, Control V, create training content materials. Now the question then comes, how do I know when I've done that? So we're going to create training content. Once the training content is created, we're done with the activity. I'll go ahead and grab this up here, our performance metric. Oops. Control C, go back over here, paste it into here, Control V. So training content materials are created. That's how we know when we're done. Our beginning date, let's just pick June 1st, and we'll do, how about July 31st in here? So we're going to do the training content, we're going to build the training content between June 1st and July 31st. Go ahead and save that. So we've got a couple of different options over here for measurement. In this case, let's say we have, oops, chapter 1 of 4. So that would indicate to me that we're about 25% done. So I'll put in 25 in here. Go ahead and save that. So chapter 1 of 4. Once I do chapter 2 of 4, it might be 50%, 3 of 4, 75, and 100%. So that's one option. Let's say, however, we were going to do this activity in the course of a week, and we just want to be able to mark it as done. But every activity's got this little wizard guy right here. If I click on that, pops open our project-based activity wizard. Again, I can put in the beginning and ending date either place. Down here, I have a couple of options. In this place, the option might be complete. So what I'm looking at down here is a checkbox. So if I mark it that way and save that, if it's incomplete, it's 100%. If it's unchecked, it's or 0%. Sorry. If it's unchecked, meaning it's 0%, it's incomplete. If it's complete, it marks it as 100%. Now, anything that gets marked as 100%, you'll notice turns the traffic light to gold. So I can go ahead and save that. So I have the different options up here. I can either use the 0 to 100%, yes, no, in the case of a particular type of activity that basically is a question, did you complete this, yes or no? You can use that, or you can use the complete. And again, it just creates a little checkbox over there for you. Now, the next thing we're going to do is assign teams of people to these particular activities. So clicking on the pencil icon by the activity team lead and team members. My mouse is freezing up here. Save. My mouse is just doing weird things. Sorry about that. There we go. Okay. Again, because there's nobody assigned to the tobacco group, I show nobody in here. I have my choice of either using the drop down so I can select somebody from a specific group, or I can just click the little black X here, which says show me everybody in the department. So I'll do that for now. For today, I'm going to go ahead and select Brian as the team lead. And when I do that, it makes him the team lead. Obviously, he's got to be a team member to be the team lead, and the email notification. Email notification is that real-time planning we talked about in the last training, where Brian will get an email on a regular basis to go back in and update this activity. In this case, he's going to go in and say, hey, I've completed chapter 3 of 4 and I'm 75% done, something along that line. I can also then assign team members. So I'm going to go ahead and assign a couple of team members. And basically what that means is these are the folks who are going to be working with Brian to complete the training. Go ahead and hit the save button. Now, when I do that, you'll notice they show up down here. The team lead shows up at the top with the L, indicating lead, obviously. The blue around there indicates email notification. So this is the person who's getting the email. And then Julie and Teresa are team members here. So that's the assignment of typically the internal team. Down here at the bottom, we have the ability to assign activity partners. You guys don't have any partners in the system right now. In that case, you would have over here, you'd have a checkbox for the partner organization. If you remember on our initial training, we had VMSG dashboard as one of the organizations. And under VMSG dashboard, we have a couple of contacts, maybe Fred and Andrea and Abigail and different folks would show up down here. I can have as many external partner organizations selected as I want. And within those, I can have as many contacts as I want. So you could have a whole list of people in that partner tab over there. In this case, we won't select anybody. So that's our first activity, our project-based activity is creating the training content. Now let's go back and look at our second activity, which is to provide 9 training sessions each month on the dangers of smoking to students and faculty. Control C again, go back over here. I'm going to hit the plus button to add a new one. Control V, provide the 9 training sessions each month. Now, since this is a QA activity, I'm just going to hit the drop down here and select QA. It'll open my little QA activity wizard for me. I'm going to say our frequency is monthly. So this is the repetitive part. Our beginning date, let's go ahead and say it's June 1st on this one. Oops. And now this is where we determine what's going to set the traffic light here. So we know that we're trying to get to 9. So obviously 9 is our green. We pick a number, whatever we decide it's going to be. In this case, I'm going to say it's 6. If we're doing 6 or less, it's going to be red, which means in between it'll be yellow. 7 or 8 will be yellow. Our metric type then would be training sessions provided. And when I hit the save button, it creates the performance metric for me. In this case, training sessions provided, measured monthly, green, yellow, and red. I'm going to go ahead and save that. Now, the reason that the light is red is because, we have nothing in here basically, so it's looking at it as 0 here. If I were to put in a value, let's say 8, and click off of it, you'll notice the traffic light changes over here to yellow, and when I save it, it'll move that up to the top as well. Now, on a QA activity, because it's a start date and it's a cycle, what it's saying, do you want to update the cycle start date at this point in time? Now, the options are no, meaning that I'm kind of halfway through the month and I've only entered part of the training session, so I'm not going to update the cycle start date. I'm going to stay within the June timeframe. I could also say, yeah, I'm done for the month. I'm going to select the next one. It'll by default give you the next month. In this case, it'll probably give you 7/1 of 23, and you can change that if you want to. Select that, or you can say current date. Current date is just going to pick today's date and put it in there as a cycle start date. So that's how that gets updated. Every time you save it, it gives you this option. I'm going to go ahead and say no for now. There is I'll show you another option here. We're going to do the 3 activities, then I'm going to build a 4th one just to show you one of the new features in here. But again, we can put the data source in down here. We have the ability to put in the time and date stamp notes field if you want to. And again, if I don't want that in there, if I accidentally put that in there, I can just go in and delete that. Go ahead and save that again. Hit no. I would also then go down in here and put in the team members and the external partners in there. So that's our second activity, is the QA activity. Our third activity then is going to be contact all 20 tobacco vendors within a mile of Wayne High School. Control C, go back over here. At this point in time, I'm going to hit the plus button again to open it up. Control V. I'm going to drop down this to quantitative measurement activity. Again, my wizard opens. I will go ahead and say June 1st through, say, oops, not that far. July 31st. So we're going to do it over the course of a couple months. My target number, as we know, is 20 tobacco vendors. So I'll put 20 in here. If I count in decimal, it's just counting widgets. So it's counting tobacco vendors, it's counting whatever, it's just decimal. Or I can count dollars. So if I do that, basically it puts you dollar signs in there and 2 decimal places and that sort of thing. So I can use this for grant tracking, for budgeting, that sort of thing. In this case, my metric type is going to be tobacco vendors contacted. And I'll go ahead and save that. Now, there was a couple of different options at the bottom here. I can enter a new value to add to total, which is the default. And here's how that works over here. So if I come in and so I'm doing this over 2 months, and let's say 2 weeks into it, I've contacted 5 vendors. You notice it moves down to the total of 5 and calculates to be 25% of the 20 in there. So I can go ahead and save that. And now maybe the next week I go in and say, okay, I've done another 5. Put that in there, adds it up to 10, calculates it 50%. So pretty simple, but it's keeping track for you, and it records the value that you put in each time. So that's one option. The other option is enter a new total value. If I save that, you'll notice the summary field goes away. And this is the case where I'm going to contact all 20 tobacco vendors within 1 week. At the end of the week, I'm going to go in here and put in 20. And it's just going to say I'm at 100%. So 2 different options, and depending on what you're doing and measuring in there. So we'll go ahead and save that as well. So that's the 3 activities we're talking about. Now I mentioned a 4th type of activity, and what it is a kind of a derivative of the quality assurance activity. So let's go ahead. I'm going to add a new one in here. We're going to say manage. Update the destruction. If I could spell it, would be good. Okay, so what we're saying now, this activity type was developed specifically to manage documents. So in this case, we're saying we're going to manage the destruction of records SOP annually. I'm going to call it a QA activity. So now that's what this timeline checkbox here. So when I click the timeline, first of all, I'm going to call it annually. I'm going to pick a start date, let's say the beginning of the fiscal year, which may be, I don't know if in your case is July 1, something like that. Open Wizard again. Now, when I hit the timeline box, it takes away all these other ones and just says % to yellow. So I'm going to go ahead and say 80% to yellow. We're going to say SOP updated. So now what's happening is this activity is a repetitive activity on an annual basis. When I get to 80% of the year, which is about 9.5 months, you can pick any value you want for 80%. I just picked that one. When I get to 9.5 months, then whoever we've designated as the activity lead is going to get an email from the system saying the light has turned yellow. You need to start going in and updating this particular standard operating procedure. When it's done, then you'll upload the new version into the document management here. I'll show you that in a second. You upload the new version. It'll keep a new version control. It'll reset the dates on this, set this back to yellow. If you get to the end of the year and it hasn't been updated, it sets it to red and sends out the email notifications again. We'll go ahead and save this new one. Again, this is not part of the plan. I just wanted to show you the new type of activity. This is really nice to use when you're doing document management, specifically if you have documents that have to be updated on a regular basis by a specific person. So in this case, I would assign the activity team lead. They're the person who's going to get the email when this turns yellow in there. Now, document management is right here. Go in here and say, okay, I'm going to add a document to that activity, and it would be the destruction of records SOP. I don't know if I actually have that file here or not. Let's take a look. Test documents. Nah, I'll just pick a document in here and upload it for now. We'll call it the destruction of records SOP. So I've got the 3 abstracts.pdf. We'll upload it. Now the file's uploaded. And we'll say, and then you can put any notes about it. You can set the traffic light. Most often, traffic lights indicate for documents, yellow is a draft, green is a final document on our end. And if we're submitting it to something like the EFAB system, you might mark it as gold as being submitted. Go ahead and save that. So now we have the destruction of records SOP attached to that activity down here. You can see there's one document attached right here. And this is the managed destruction of records SOP. Again, we would have a team member assigned, and they're the person who's going to be responsible for this. So, and you can have as many of these different activities as you want assigned to different people over different timelines. So it seems to really be popular with folks who are managing policies and standard operating procedures and memos of understanding and that sort of thing, where they have to be notified and updated on a regular basis. So that, let's go back here. Yeah, that was what we wanted to get through today, basically, is using the template to input a plan here. Now, if I go back to the PowerPoint here, so we're going to take the plan we just did and again look at it in the planning model here. So let me go down here. So the group was Tobacco 2023. The initiative was tobacco cessation. Under that initiative, we selected reduce smoking in high schools. We were working with reduce smoking at Wayne High School, and then the steps we're going to go through to get there. So that is the operational planning process. What I would ask everybody to do at this point in time, the next training we just call operational plan review. And what I'd like everybody to do is to go in either using the template that's attached to the meeting invitation, or go straight into the system. Everybody has access to that training group. Just build yourself a service or initiative under the training group and build some kind of a plan. Something very simple. We've had a lot of people had fun with this, so they've actually done like planning my Christmas vacation, planning my Las Vegas vacation, planning my kid's birthday, things along that line. Yeah, at the minimum, if you would put in one service or initiative, one goal, one objective, and ideally think of 3 different types of activities. So the 3 different types of activities, kind of build out one of each of those, or maybe even the 4th one if you want to use that new timeline activity. But just so that you go through the process of entering it either in the template or in the system. If you enter it in the template, what we're going to ask you to do during the training session is we're going to give you control, and we're going to walk you through the process of entering your plan into the training group on the system itself. The other option is if you actually have a plan that you want to enter that's part of your work, your strategic plan, a piece of it, or your chip, or whatever it happens to be. If you want to enter a piece of a plan, feel free to go in there. And what we'll do is come back and just, everybody who's on the training, we'll ask everybody in order to go in and either show us their plan in the system, and we'll kind of go through and critique it a little bit. Or if you haven't entered it in the system yet and you have something either on a paper or, on the template, we'll ask you to go in and enter it in the system. So that was the training for today. Any questions? Anything else you'd like to see before we move on? Okay, we will work with Marcy to schedule the next training. Typically, it's going to be probably next week. We will ask everybody again to go in and create something, come back on a training, and we'll just kind of go through and review them. So thank you, everybody, for your time today. Have a wonderful day.